is Britta. I'm a student nurse, and I'm here to take care of your tracheostomy. Can you please verify that the name and date of birth on your wristband is correct? Yes, it is. Perfect. Do you have any allergies? No? Okay. I know it can be difficult to communicate with the trach, and so if you want to go ahead and give me a thumbs up for yes, thumbs down for no, and if at any point during the procedure you need to stop because you're having pain or shortness of breath, or you have a question or concern, raise your hand like this, and we'll take a break. Does that work for you? Okay, perfect. As I was saying, tracheostomy care is going to include 4 things: suctioning, replacing your inner cannula, peristomal site care, and changing the stabilization collar. We do this to increase your oxygenation, remove any secretions, and decrease your risk of skin breakdown or infection. Do you have any questions at all? Okay, let me know if you do later on. Before we begin, I do need to get a quick baseline assessment. So do you have any pain at all? No? Okay, that's good to hear. I'm also going to take your vital signs, get your O2, your respiratory rate, your heart rate, and then I would assess your respiratory effort, and then finally I'll listen to lung sounds. Okay, so now that we have this baseline, I'm just going to make sure that I have everything here that I'm going to need with me. Into the room, I brought a bottle of sterile saline, a new inner cannula, a drape for my patient, mask and gloves, or mask and goggles. I'm putting those on right now. A size 12 French suction catheter, and then a trach cleaning care tray. In there is the stabilizer and the gauze, and we're also going to use it as a basin. Alright, at the bedside, I'm just going to make sure we have all of our emergency equipment here and working. So we have the ambu bag attached to an O2. We have working suctions on, and it's at 120 millimeters of mercury. We also have 2 trach kits, one of your size and one size smaller. We also have 1 inner cannula. Alrighty, so now I'm going to begin cleaning up my workspace, putting on gloves, and wiping off the table. And we're going to let this dry for 2 minutes in between, and repeat. Alright, let this dry for 2 minutes, and then I'm going to discard my gloves, and then I'm going to replace the items. Okay, next I'm going to drape my patient. Position her in high feathers. I already explained the procedure, so I'm just going to check for understanding. Do you have any questions or concerns? Alright, and then I'm also going to provide patient privacy by closing the curtain or the door. Alright, next I'm going to turn on the oxygen to 100% or 15 liters and attach it to the ambu bag. Suction's already going. Alright, so next I'm going to take off my gloves, perform hand hygiene, put on clean gloves, and prepare my supplies. I'm going to carefully open this, touching only the tip or the inside of the basin. Sorry, touching only the outside of the basin. Open it up, set it to the side, and then the envelope for the catheter, only touching the envelope still, and I'm going to move it over here, attach it to the suction, still only touching the paper envelope, attach it to the suction, and I'm going to leave just this white tip up. I would actually, in real life, place it on top of the suction canister, but I'm just going to place it right here for now. In a safe spot, it's going to stay sterile over there. Okay, next I'm going to remove the oxygen. Actually, first, I'm going to pour in the sterile saline. Okay. And I will remove the oxygen mask from the patient, and then I will hydroxygenate her. We're going to do that with the ambu bag. It's already on, and we're going to do 3 to 4 breaths. 6 seconds in between each breath. Okay. I'm going to take off my gloves, perform hand hygiene, and I can put on my sterile gloves. Remember, Miss Elephant, that if you need a break at all, or you're having a hard time breathing, raise your hand and we'll take a break, okay? Okay, so I'm now sterile, and I'm going to, okay, I'm going to grab the suction catheter, only touching the clean white tip, and then I'm going to gently shake it loose. Okay, with my sterile hand, I'm going to grab this, and then I'm going to test that it works. I can hear the suction's already on, and I'm dipping it in the basin to make sure that it's working. Alright, so it's working how I would like, and now I'm going to place it into the patient until they begin to cough or I feel resistance. Okay, I feel resistance, and I'm going to occlude the suction and then slowly pull out as I twist and suction out, and making sure to not suction for more than 10 seconds. If my patient needed to be resuctioned, I would clear the line, and then with the sterile saline, and then I'd give her at least a 30-second break in between suctioning. At this point, I also would assess her O2 sat. So if it was too low, I would hyperoxygenate her with the ambu bag. She looks like she's doing okay. She's not going to need another suction. So I'm just going to clear the line here, and then I'm going to discard the suction cap and the gloves, do hand hygiene, and replace my patient's oxygen mask. Oops. Okay. So next we're going to do the inner cannula. Are you still doing okay, Miss Elephant? Alright, that's good to hear. Just gonna put this drapes back up on you. Alright, I'm doing hand hygiene, putting on clean gloves, and then I'm going to prepare the cannula supplies. Opening this up and dropping the inner cannula into the trach care kit. Okay. And now I am going to perform hand hygiene just once more. And put on my sterile gloves. So my hand is inside. I'm just going to touch the sterile part of the glove to adjust a little bit. Okay. Alright, so I'm now sterile, and I'm going to use my non-dominant hand to remove the patient's oxygen mask. Okay, and I'm stabilizing the faceplate. And with my dominant sterile hand, I'm going to remove the old inner cannula. Okay, it's out, and I'm going to discard that in the trash and replace it with the new inner cannula. I'm only going to touch the very tip of it. Alright. stabilizing the faceplate with my clean hand. Alright, it's locked in place, so it's now a clean procedure. And at this point, I'm going to still stabilize the faceplate with my clean hand and with my sterile hand. Remove the old dressing from the patient's trach. Discard that. Alright, and at this point I'm going to assess the site. I don't see any redness or signs of infection or irritation. There's no rash or skin breakdown. The trach is midline with the patient. So I'm going to continue on with peristomal site care. I'm actually just going to replace the oxygen mask for you. Okay, and now I'm going to discard my gloves and just do some hand hygiene and put on new gloves. Actually, I'm gonna clean up a little bit. Okay, and that made my gloves dirty, so I'm just going to take them off, perform hand hygiene, and then put on clean gloves once more. Okay, so next I'm going to remove all the items that I won't need for this procedure with my clean gloves because it's a clean procedure now. We won't need these. I can actually just place this to the side, and I can pour in my sterile saline into the basin. Alright, Miss Elephant, we're going to start cleaning the site insertion. Remember to let me know if you're in any pain, okay? So I'm going to remove the patient's oxygen mask. Sorry. What's happening? Alright, in real life, hopefully the inner cannula that just slipped out hopefully would not, so I'm going to replace it as if it didn't. Towel is becoming loose. Okay, it's okay now. I'm going to continue on with the site care, dipping the Q-tips in the sterile saline, and I'm going to stabilize the faceplate, and then I'm just going to swipe from the inside of the insertion site out. Only once. I'm going to discard, and then I'm going to repeat that a few times. From the inside out, only swiping once. One more time, inside out. Okay, now I'm going to dip my gauze in the saline and clean underneath the faceplate. Oops. Still wiping from the inside out and discard that. Okay, I'm going to pretend that these are still new. And then I'm going to, once again, clean the top of the faceplate and then discard this. And then I'm going to pat dry underneath the skin, underneath the faceplate, and then on top of the faceplate. And discard that. Alright, and next I'm going to, I already did the site assessment, so I'm going to replace the gauze. Okay, so this is all good now. I'm going to clean up my area a little bit, discard all of that. I'm going to take off my gloves, do hand hygiene, and replace the oxygen source once more. Alright, Miss Elephant, we're doing good. We're just about done. We're going to change our stabilization color, and then we'll be done. I'm doing hand hygiene, and then I'm going to call in my second nurse for my assistant, and she's going to stabilize the faceplate while I change the stabilizer. So we're both putting on clean gloves after hand hygiene, and I'm going to remove the oxygen mask once more. And then she's stabilizing it, and I'm going to remove one side at a time. during this time, I'm going to look around the neck for any signs of skin breakdown caused by the stabilizer or the face tip. Okay, so I don't see any skin breakdown, so that's good. Alright, so the inner cannula just fell out. I'm going to place it back in just a second again. Once again, pretending that it didn't actually happen, because the other nurse was stabilizing it. Okay. Obviously I wouldn't do this in real life, but okay. So I'm going to replace, alright, so the stabilizer is changed. I'm going to make sure that 2 fingers can comfortably fit in there so that it's not too tight for the patient. Doesn't cause any skin irritation. Ms. Elephant, does that feel okay? Alright, so 2 fingers fit in there. I'm going to replace the oxygen mask one last time. And alright. So now I'm done with the procedure. I'm going to clean up my trash. My still dirty gloves on. Oh, there it is. Alright, this is all going to go in the trash. I'm going to take off my gloves, do hand hygiene, and then I'm going to do the last assessment. Ms. Elephant, how was that? Was it tolerable? Okay, good to hear. Are you in any pain right now? No? Alright. I'm going to do another baseline assessment, so I'm going to redo your vital signs, your O2, your heart rate, your respiratory effort, and then also listen to your lung sounds once more. Okay. Do you have any questions or concerns about the procedure? No? Alright. You do have your call light right here if you need anything, so don't hesitate to use it. Yeah. Before I head out, I'm going to make sure that I have all the emergency equipment still at the bedside. I have the ambu bag still attached to oxygen. Suction is still on at 120 with a clean suction catheter attached. And we still have the 2 trach kits and the inner cannula. Alright, and then I'm going to hand hygiene and leave the patient's room, and then I'm going to document the date, the time of the procedure, the patient's tolerance, the site assessment, the peristomal site assessment, the color consistency and amount of sputum that's collected, and then the beginning and end vital signs, O2 sat, respiratory assessment, or an effort. Yeah. Alright. And then I will be done with the procedure.